Hi, my name is Claudio Schuftan, and I come to you from Ho Chi Minh City in Vietnam. I am originally from Chile. I'm a pediatrician by training, but have been working on public health nutrition for the last 30 or 40 years. I was invited by Reza to prepare this video in which I would be focusing particularly on the situation, the food and nutrition challenges that we face at the beginning of the first quarter of 2026. Well, if you ask me what I see as a challenge, they have to be divided into acute challenges and more chronic challenges that we have had for many years. The acute problem is related to the war in the Middle East, started by Israel and the United States, that has shot up the prices, and that has, of course, very significant humanitarian and health and food and nutrition consequences. I don't need to tell you how the relationship between the prices of oil and food and nutrition situation are linked. It's usually through the cost of petrol, the cost of fertilizer, pesticide, herbicides that are all subproducts of oil. I just can tell you that even if the conflict would start stopping or finding a way out, it will probably be with us in terms of the food and nutrition consequences for quite a long time. There is much more on the chronic side. The chronic side has been a relentless problem for decades in terms of the malnutrition that we find that is associated with the galloping situation of poverty getting worse and inequality getting worse. And this is what mainly we have to worry about in terms of understanding that the acute situation is not really being superimposed on a regular, normal situation. It's being superimposed on a chronic situation that was already very unsatisfactory in terms of food and nutrition. The situation in terms of the chronic situation has to do with a number of factors. On the one side, the food system that we live under in most of the world is an agroindustrial food system that depends on oil, and it is controlled particularly by a bunch of transnational corporations that not only have controlled the agricultural sector, but now have basically controlled the whole food chain. They have integrated their influence from soil to your plate. And again, this is something that most of you who are listening to this understand very clearly. One of the things that is most worrisome in this agro-industrial system that we live under is the control that these corporations are having now over data that have to do with climate in every single location around the world, soil situations, rainfall situations, crop outputs in the last 15 years. This is all being integrated into artificial intelligence to find out where the situation or the opportunities for them exist. What do I mean by opportunities? The agro-industrial system is backed by very important financial resources. And one of the things that they are doing is that they are buying up land in the continents that still have available land that is not idle. It belongs already to somebody, to some families, to communities, and they are eking them out in this phenomenon called land grabbing. But this is not only happening in terms of international, of rich countries buying land in the third world. it is also happening in terms of at the national level, where the people in the local bourgeoisie are also finding out that with the commodization of the food system, there is a profit to be made by involving themselves in agriculture. Most of this involvement is related to monocultures. Monocultures that are not always food products, but very often they are products that are inputs to the industry at the global level, like palm oil or rubber. I mean, there are a number of examples on where these humongous pieces of land are utilized for the production of monocultures for export, leaving very often the local situation, the local population without the means to produce their own food. Because please don't forget that a good 70 to, if not 75% of all the food that you and I eat is produced by small producers that are very often using agroecological practices that are environmentally sound and that are to be supported. But the capital injections into the food system is not coming to the agroecological agriculture. It's going to the expansion of the agricultural and industrial system that controls anything between seeds and your plate, as I basically said before. Efforts to overcome this have, most importantly, up to now, been focused on poverty alleviation. Because of the relationship of malnutrition and poverty, the best efforts that you can see, other than having nutrition education to mothers that basically teach them what they cannot afford. I mean, we have spent millions of dollars over the last 50 years doing nutrition education with food groups, and it's all nonsense. The people basically have no resources, financial resources, to buy themselves food. Very few and less people are producing for self-consumption. So the main problem is that poverty alleviation efforts considers that people that have been rendered poor should be brought up, and it is their fault that they are in a situation of poverty. The problem is not poverty alleviation. The problem is the reduction of inequalities, the reduction between the rich and the poor. And we do very little about it. This is the main problem that we have now, with the very much increasing gap between the haves and the have-nots. So disparity reduction is where we really need policies and pressure from below and pressure from us professionals to make the decision makers understand that this is the only way that we are going to long-term serve the people who are rendered poor. They are not poor. A system is rendering poor, and we have to understand that. I will this time not cover, perhaps leaving for another occasion, the denunciation of the whole problem of ultra-processed foods or ultra-processed products and the relationship with non-communicable diseases. This is another challenge for the first quarter of 2026. And please don't forget, breastfeeding is another topic that we probably should be talking over and over for the last 50 years or more, because we haven't really succeeded. The important thing is, from the things that I have mentioned, we as nutrition professionals, are we doing anything about it? Are we doing anything about the reduction of disparities? Are we doing nothing? Or Are we throwing yet another webinar to discuss these things? Yes, I see very good ideas in webinars. And there is a closure with some good ideas, and come next Monday morning, pretty much everybody continues doing whatever they have been doing forever. This short video, dear friends, I see only as an appetizer. With your reactions to it, I look forward to the main course.